I am here in Davos with someone who really helped the world get out of the pandemic, helped this event actually happen by helping to create the vaccines that really rescued us from the coronavirus. I'm here with Stephane Bancel, who is the CEO of Moderna, which really did pioneer a lot of the mRNA technology that underpinned the vaccines that we have all become very accustomed to over the past couple of years. Thank you so much for being here. Let's start where you announced yesterday about the RSV news, this question of a vaccine for older people that could potentially protect against the virus in the triple-demic or whatever people are saying. What's next? How is this where does this fit in the evolution of the different medications you're working on?
Great. Well, thank you first for having me. We are very excited about the RSV vaccine because, as you know, there is no vaccine available today, and a lot of elderlies get hospitalized or die every year from RSV. Pre-COVID, it was the number 2 cause of hospitalization by a respiratory virus. But what is more exciting for me is this is the Moderna platform coming to life. We've been working at this technology for 10 years. We always believed, because mRNA is an information molecule, that if it will work in one, it made no scientific sense that it will not work in many more. So what we're working on is a lot of vaccines, around 30 plus vaccines today, respiratory vaccine, but also vaccine against virus that once in your body, stay in your body forever. There's one I'm very passionate about, CMV. It's not very well known by the public, but in the US, it's a number 1 cause of birth defect, more than Down syndrome, caused by a virus if mom gets it during a pregnancy. And this, we should stop all those accidents happening to those children. The other thing is cancer. We announced just before Christmas some exciting data in skin cancer, melanoma, where we compared ourselves to the best drug today, Merck Keytruda, and we showed a 44% reduction in recurrence or deaths. We're very happy with our partner Vertex. We now have inhaled mRNA to go into the lung of kids with multiple sclerosis, with cystic fibrosis, who cannot respond to Vertex drugs. We're also working in cardiology drugs. So I really think over time, you're going to see a lot of drugs coming from Moderna.
Here at Davos, one conversation that I've been having with a lot of people is the concern about the reopening of China, the positive about how that might juice growth, but the negative of the mass infections that could potentially produce some sort of mutation in the existing coronavirus. Have you tracked that? Do you have a sense of what that risk is and what that would look like?
So it's really hard for us to track it because we're not getting the raw data coming out of China. Our team believes that the risk is not high, that there is a severe mutant coming out of China. It's possible because it's such a large number of people, but we don't think the risk is high because there's very little resistance to a virus infecting people because either they got a not great vaccine a long time ago or they didn't get vaccinated, and most of them never get infected naturally. So when the virus infects somebody, it doesn't have a resistance that it has in the West. And so we think that there is little reason for a virus to evolve in terms of variants of concerns.
If there is some sort of mutation or another potential pathogen that could create another pandemic, is there any lesson that has been drawn in terms of creating a more efficient process? And I recognize that it was pretty efficient for vaccine standards, for rolling out something, getting it into the public, and preventing 2020 from happening again.
Sure, and we've been working a lot on that since the pandemic, always thinking, okay, what could we do different next time? And I really hope, of course, next time doesn't happen for the world and for us.
Do you think that it will happen?
I think it's possible. I mean, if you look at the change in the climate, the number of people on the planet, how we travel, if you talk to scientific experts, they say, we're going to get another one. It's impossible to know if it's in 3 years or 25 years or 100 years, but we're most probably going to get another one. And so what we're doing at Moderna is a few things. First, building a global manufacturing network. Because one of the reasons it took so long to get vaccine out of the door after they were approved is we had never sold a product before. So there was no plants ready to make a lot of products. Well, today we have more than 2 billion doses of annual capacity today. In 2019, we had 0. And we are building a plant as we speak in Canada, one in the UK, one in Australia, one in Kenya. I hope to build a couple more so that in every continent we have plants and we have more capacity so that for any given time to do the clinical studies, we can make at risk many, many doses for a vaccine. Think about it if it were to happen today. In 6 months to develop a vaccine, which I think we could do next time instead of a year, we could make 1 billion doses. When the vaccine was approved, we shipped only 20 million doses. That's all we had.
How do you combat the fact that there is this huge anti-vaccine movement that seems to be pretty sticky in terms of its persistence?
Yes, it's something that's really sad to see. I'm trained in science. I believe in science, and people not believing. Experts like FDA who review the data, doctors who run the clinical trials. We didn't run the clinical trials. He was run by another company, and he was assessed by an independent data safety monitoring committee, like it is always done in the industry, to ensure the highest level of quality of science. Because it's a really important business. You make a product that's going into somebody's body, and you're trying to protect them. You're not trying to hurt anybody, obviously. And so I think a lot of education. I think also as we get on the other side of COVID, I'm hoping that things will calm down a little bit. As you know, in the US, well, it was very political. Unfortunately, there are countries outside the US, like for example Portugal, had an amazing rate of vaccination because it was not political. All politicians said once it's approved, we're going to trust the team of scientists and doctors who approved it, and all of us need to get it because we're going to go through this pandemic as a country together. We need to protect the elderly, and we need to open the economy again. And that's what kind of everybody was saying, and so people followed, and the vaccination rate was one of the highest in the world.
So just to conclude here, I'm wondering from your perspective, do you think that we could see 2020-style lockdowns again based on the technology that we have, how quickly we could potentially ramp up vaccines regardless of the pathogen that comes down the pike?
So, of course, that would be for the authorities to decide. As I said, I think we could go down to maybe 6 months from a new virus to product approved next time. But you still have a few months where you might have a lot of infections and you might have to protect people that are high risk, the elderly. And again, we got lucky on this one. The young children were not, hurt at the beginning in 2020. If you remember, it was mostly the elderly. Let's think about 1918 flu. We were losing as many elderly as children. So we need to be very careful and to do the right thing to protect as many people as we can.